This is Dr. SERAN Reddy, the Academic Director and the CEO of ADRPLEXUS and Anesthesia faculty. What is the definition of anesthesia? You might have seen when going to the anesthesia theaters, operation theaters, there are two types of anesthesia. Basically, general anesthesia or regional anesthesia. Why do we have to anesthetize the patient? Basically, when the patient is undergoing surgery, the patient should not be remembering anything. And that is amnesia. Analgesia, they should not feel pain, and the muscles has to be relaxed when the surgeon is operating. So this is what we try to achieve. So the definition per se, whenever if we see, if someone tries to give an incision, the immediate response for us is the reflex response is to withdraw it. So that reflex response has to be lost. That physiological reflex response is suppressed. So write down the definition of anesthesia: loss of physiological reflex response to a surgical stimulus with or without loss of consciousness. So what does that mean? If with loss of consciousness it is general anesthesia, without loss of consciousness it is regional anesthesia. So in this particular chapter we will be discussing about the important drugs, just for the names, how the history evolved, and each and individual drug as the time progresses today and tomorrow we'll discuss about this. The term anesthesia is coined by Oliver Wendell Holmes, and the term balanced anesthesia is coined by John Lundy and Ralph M. Water. John Lundy and Ralph M. Water. This is what is balanced anesthesia. Balanced anesthesia is an amalgamation of amnesia, analgesia, and muscle relaxation. Amnesia, analgesia, and muscle relaxation. Okay. Then coming to the important drugs, like how the anesthesia evolved. Nitrous oxide. Nitrous oxide is also called as a laughing gas. This laughing gas was discovered by Joseph Priestley. Joseph Priestley is also the same person who synthesized and discovered about oxygen, which was there, and like he was the one who said like oxygen is the gas which is required, all these things, Joseph Priestley. And this nitrous oxide has analgesic properties, so that why it can be used for anesthesia. It was first demonstrated by analgesic properties were postulated by Humphrey Davy, and by taking this, Horace Wells publicly demonstrated in the year 1844, and it was a failure. Why it was though nitrous oxide has analgesic property, why it failed was when Horace Wells called everyone. So today I'm going to demonstrate that with the help of nitrous oxide the surgeon can operate and the patient won't feel the pain, he won't remember anything. But it was a failure for the reason nitrous oxide has a very good analgesic property, but it doesn't have much of amnestic properties and muscle relaxation properties, so that's why it was a failure. So this happened in 1844. 2 years later, see, we will discuss about this MAC, minimum alveolar concentration, is the concept like which we will discuss tomorrow, so that you will be able to understand better about like why nitrous oxide demonstration was a failure during that time. Exactly 2 years later, everyone noted this? I hope everyone noted this. Ether. This is the first public demonstration of ether, and this is the ether inhaler. And this ether is also known as sweet oil of vitriol. A dentist by name W.T.G. Morton, who first publicly demonstrated the use of ether in Boston, and this is the first public demonstration which happened on October 16th of 1846, and That's why he's called as father of modern anesthesia, and World Anesthesia Day is celebrated on 16th October. So first public demonstration by W.T.G. Morton. Date 16th October 1846. The father of modern anesthesia is W.T.G. Morton. World Anesthesia Day is celebrated on 16th October. This is about ether. So if you say, like, this might be asked as an image based question, like what is this, the first public demonstration of ether, and here the important points is W.T.G. Morton and 16th October are the important points. Then coming to chloroform. Chloroform has been notorious as the official kidnapping agent in our movies, but chloroform was one of the most important anesthetic drugs in last 2 centuries. Now we are almost stopped using chloroform for various reasons, because of its side effects, which we'll discuss tomorrow. But chloroform was first used by James Young Simpson, and it is popularized by John Snow. So John Snow is also called as father of anesthesia. Father of modern anesthesia is W.T.G. Morton, but father of anesthesia is John Snow. Heard about John Snow somewhere else? Type in the chat box. Heard about John Snow somewhere else? Not Game of Thrones. Anything else? Very good, Altaf. Epidemiology. Epidemiology. He is also the father of epidemiology. You remember in SPM, there's a Broad Street where they had discussed about cholera epidemic, from what is the source. So that is John Snow. So John Snow is not only the father of anesthesia, but also the father of epidemiology. And who is the father of public health? Father of public health? Fantastic. Good, Divya. Father of public health is cholera. Okay. Then cocaine. Cocaine was first to be used as topical or local anesthesia. We will discuss about cocaine tomorrow. Its analgesic properties. This cocaine has analgesic properties, and it was demonstrated by Carl Koller. And till date, it was the only naturally acting local anesthetic drug. Cocaine is the only naturally acting local anesthetic drugs. Tomorrow we'll discuss local anesthetic drugs exclusively. Then coming to spinal anesthesia. You might have seen, like, many times the spinal anesthesia is being administered. Nowadays, the only drug which we are using most of the times is bupivacaine. But the first drug which was used for spinal was cocaine. And first spinal anesthesia is given by doctor by name August Beer. August Beer. He is also the same one who postulated something called Beer's block, or intravenous regional anesthesia, which again in regional anesthesia tomorrow we'll discuss. Intravenous regional anesthesia. Then muscle relaxation. If you've seen, like, geographic channels or discovery channels, you might have seen the hunters when they are trying to hunt the animals with just an arrow, that animal fall down and it won't wake up and it won't run again. See, it's like, suppose this simple, assuming the size of pen, if it comes and hits me, it doesn't cause much of the effect, but it's the same size, like same like one arrow going and hitting the lion or tiger. It acts such, the arrow doesn't cause any effect, but those arrows are dipped in the leafy extracts which has the muscle relaxant properties, the curare leaves. So that's why once it goes and hits that animal, what happens is all the muscles will be relaxed, and skeletal muscles, even if the animal want to run or walk or want to stand up, they can't do that because all the skeletal muscles are relaxed. That is why, taking up the same property to the medical fields, the first drug used was curare group of drugs. Curare group of drugs. discovered by Harold Griffith. Harold Griffith. Tomorrow, an exclusive chapter on muscle relaxants we'll discuss. Then, coming to laryngeal mask airway. Laryngeal mask airway was, how many of you seen this LMA in your operation theaters? This is LMA, laryngeal mask airway. It was introduced by Archie Brain. Archie Brain. Archie Brain. So we'll discuss about LMA in the latter part of the day. So this is called, like, once we insert this LMA, it will be at the level of larynx, and you, through this pilot balloon, if you give the air, this will inflate like this, and it prevents the leakage. So this is one of the ways, like, in addition to the face mask and endotracheal tube, this is the one more device through which we can deliver the gases. Then endotracheal tube. Probably every one of you might have done or at least seen endotracheal tube in endotracheal intubation. So this endotracheal intubation, we will discuss about this endotracheal tube today. But endotracheal tube, endotracheal intubation was first done by William McEwen. And it is popularized by Ivan Magel. Ivan Magel. See, this is called the pilot balloon, and from here you give the air, and this cuff will get inflated. And here there will be something called Murphy's eye, which we will discuss when we are discussing about the endotracheal tube. Okay, this is all about the anesthesia evolution and the basics. So here, what is anesthesia? The loss of physiological reflex response to surgical stimuli with or without loss of consciousness. So when I'm trying to say the points, like, I'm just trying to demonstrate how you can do that. If I say, like, only 1 minute time is given for this chapter, how you can utilize, I'll practically show it for this chapter. You can start following this for the next chapters. So how we can do that? Anesthesia. You can see that loss of physiological reflex response to surgical stimuli with or without loss of consciousness. The term anesthesia is coined by Oliver Wendell Holmes. The term balanced anesthesia is coined by John Lundy and Ralph M. Water. It's a triad of amnesia, analgesia, and muscle relaxation. Nitrous oxide is a laughing gas, first synthesized by Joseph Priestley, analgesic properties by Humphrey Davy, and it was first publicly demonstrated in 1844 by Horace Wells, and it was a failure because of its no amnestic properties. Then ether is also called as sweet oil of vitriol, first publicly demonstrated on 16th October 1846 by W.T.G. Morton, which is successful. That is why he is called as father of modern anesthesia, and World Anesthesia Day is celebrated on 16th October. Chloroform was first introduced by James Young Simpson and popularized by John Snow. Cocaine was the first local anesthetic and naturally occurring or topical local anesthetic. It is the only naturally occurring local anesthetic, and the analgesic properties were demonstrated by Carl Koller. Spinal anesthesia, the first drug used was cocaine, and by August Beer, and it was he also postulated intravenous regional anesthesia, B.S. Block. Then muscle relaxants, curative group of drugs were used and first introduced by Harold Griffith. Laryngeal mask airway by Archie Brain, and see the image is important. Then endotracheal intubation, first done by William McEwen and popularized by Ivan Magel. So that's it.